Hello, and welcome to this video today. Today, we are going to discuss the strong link between diabetes and heart disease in the elderly and how both are affecting health. Diabetes and heart disease are common in older adults and typically together, which makes things more complicated. In this video, we're going to discuss how all these conditions are connected, how they affect older adults, and most importantly, what you can do to prevent or manage them for a healthier life. Section 1. Understanding heart disease and diabetes. Heart disease includes numerous issues that relate to the heart, including coronary artery disease, heart failure, and arrhythmias. Coronary artery disease is the most common type. It occurs when the arteries that supply oxygen and nutrients to the heart are clogged or obstructed by plaque. Diabetes is a condition in which the body does not produce enough insulin. Type 1 diabetes, or does not utilize insulin effectively. Type 2 diabetes. Insulin is a hormone that regulates blood sugar, and when it fails to function, blood sugar levels can rise to unhealthy highs. Diabetes and cardiovascular disease have many common risk factors, which include high blood pressure, high cholesterol, obesity, sedentary life, unhealthy diet. These conditions also worsen each other, creating an unhealthy cycle that can greatly affect the health of older adults. Section 2. How diabetes and heart disease affect older adults. When diabetes and heart disease coexist, they can heighten the risk of complications and reduce the quality of life. Let us examine how these illnesses impact older adults. 1. Increased risk of heart attacks and strokes. Diabetes with high blood sugar can damage blood vessels and put one at risk for atherosclerosis, which is the buildup of plaque in the arteries. This can result in heart attacks and strokes, particularly in the elderly who already have compromised hearts from heart disease. 2. Heart function problems. Diabetes can also put you at risk for heart failure, a condition where the heart does not pump well for the body. This can be especially risky for elderly patients who already have heart disease. 3. Kidney damage. Diabetes and heart disease can damage kidneys. Diabetic nephropathy, or kidney damage, is a result of diabetes. Heart disease usually worsens kidney problems by decreasing blood flow to the kidneys. This is especially problematic for the elderly because kidney function decreases as they age. 4. Nerve damage. Neuropathy. Diabetes also harms nerves. Neuropathy, making it hard for people to feel their hands and feet. This makes it harder for older adults to notice injury or infection. If the person also has heart disease, circulation to the legs and feet can worsen. This increases the risk of infection and problems like gangrene. 5. Poor blood sugar control. Heart disease makes it harder to keep blood sugar in balance. When the body is under stress, the heart makes the body struggle to regulate glucose, causing spikes in blood sugar. It is harder to control diabetes. Section 3. Treating heart disease and diabetes. Simultaneously, heart disease and diabetes in the old needs an integrated approach to addressing the special issues that two diseases present. The following are effective ways of managing and controlling both conditions. 1. Test blood sugar levels regularly. It's extremely crucial to check blood sugar levels every day to manage diabetes. Elderly individuals with heart disease need to closely collaborate with their doctor to set blood sugar goals and check their blood sugar levels frequently. A video idea: an older man or woman checking their blood sugar with a glucose meter. 2. Medications for both conditions. Some drugs can treat both diabetes and heart disease. For heart disease, doctors can prescribe statins, beta blockers, and ACE inhibitors. For diabetes, doctors can require metformin or insulin. It is important to follow the drug regimen given in order to effectively address both conditions. Video idea: an older adult taking their medication as prescribed, possibly with the help of a caregiver. 3. Create a heart-healthy, diabetes-friendly dietary pattern. Needs a meal plan to treat diabetes and lower the risk of heart disease. One has to eat a lot of fruits, vegetables, whole grains, lean protein, and good fats. Try to reduce sodium, sugar, and unhealthy fats as well to manage the two diseases. Stock video concept: an older man or woman preparing to have a meal of vegetables, healthy proteins, and whole grains. 4. Regular exercise is good for blood sugar control and good for the heart. Elderly individuals should try to do at least 150 minutes of moderate exercise a week, like walking, swimming, or biking. Exercise helps with weight management and improves circulation. Stock footage idea: an older man or woman walking in the park or participating in a gentle exercise class. 5. Weight management. Buying at a healthy weight is important in managing diabetes and heart disease. The elderly need to eat a healthy diet along with exercise to reach and sustain a healthy weight. Losing weight, even if it is only a little, can be a big help in the management of these two conditions. Stock footage concept: an older woman or man walking or exercising lightly in order to maintain a healthy weight. 6. Control blood pressure and cholesterol. High blood pressure and high cholesterol are significant factors that can result in diabetes and heart disease. Older adults must visit the doctor for regular checkups to get their blood pressure and cholesterol levels tested. They must follow their doctor's instructions for how to control the levels through medication, diet, and exercise. Stock footage idea: an older man or woman having their blood pressure or cholesterol checked at a doctor's clinic. Section 4. Avoiding heart disease and diabetes complications. It is necessary to avoid complications that may develop as a result of the presence of both diabetes and heart disease. The following are some of the most significant ways to minimize the risk of complications. 1. Stop smoking. Smoking is a major risk factor for heart disease and diabetes. Quitting smoking has been proven to greatly lower the risk of complications like heart attack, stroke, and poor blood flow. Stock footage idea: a grown man or woman gives up smoking or throws away a pack of cigarettes. 2. Manage stress. Chronic stress can harm heart health and make blood sugar control more difficult. Older adults can use stress-reducing methods like slow breathing, meditation, yoga, or visiting with family and friends. Stock footage idea: older person meditating or taking deep breaths in a serene setting. 3. Regular doctor's checkups. Elderly people who have diabetes and heart disease need to visit their doctor regularly to monitor their health. Cholesterol checks, blood pressure checks, and eye examinations are standard tests that find early warning signs of problems. Video idea: a man or woman in their senior years at a health facility being given a regular checkup. 4. Foot care. Diabetes can also damage nerves, making it hard to feel in the feet. When combined with poor circulation from heart disease, it could put you at greater risk for infection. Older adults need to check their feet regularly for cuts or infection, and see a doctor right away if they need to. Stock footage idea: an elderly person inspecting their feet for blisters or cuts. Section 5. Why support is important. It is not simple to manage an elderly person with diabetes and heart disease, but with adequate support, the two conditions can be effectively addressed. Some of the things that family members and caregivers can do to help include: 1. Encourage healthy lifestyle habits. Encourage your loved one to live a healthier life by persuading them to eat a healthy diet, exercise, and take their medication. 2. Offer emotional support. It is emotionally challenging to have heart disease and diabetes. It does help to talk to and support each other, because being emotionally well is a large component of coping with long-term health conditions. 3. Coordinate healthcare. Cooperate with doctors to ensure your loved one gets appropriate treatment and follow up. Help keep track of doctor visits, medication, and lab tests. A family caregiver is helping an older person with medication or taking them to see the doctor. Conclusion: briefly, diabetes and heart disease are potentially dangerous conditions that many seniors experience, and when combined, they can make life very hard. But with a healthy lifestyle, correct medication adherence, and regular doctor appointments, seniors can manage these conditions and avoid complications. With close cooperation with doctors and a healthy lifestyle, seniors can still lead active and satisfying lives. Thanks for viewing today's video. Take care,